Stop for a second. What if I told you the pill sitting quietly in your medicine cabinet right now, the one you trust, the one you take without thinking, could be increasing your risk of a heart attack? And here's the part that should worry you even more. What if it's not just one pill, but a combination you're taking every single day that's slowly putting pressure on your heart without any warning signs? Listen carefully, because one of these is so common that almost every person over 60 has used it in the last 30 days. This is Dr. Danzy, and you're watching Dr. Danzy Senior Health Tips. I'm not trying to scare you, but you should know this. After the age of 60, your heart becomes more sensitive, more reactive, and far less forgiving to certain medications that used to feel completely harmless. And the danger is silent. No pain, no signal, no early warning. Just one moment, and everything changes. Let me ask you something. Do you ever feel your heart racing suddenly, even when you're sitting still? Do you sometimes feel pressure in your chest, like something heavy is sitting on it? Do you feel more breathless than you used to, even with simple activities? Most people ignore these signs. They blame age, they blame weakness. But sometimes, the real cause is sitting right inside your daily medication routine. And today, I'm going to show you something most people never realize until it's too late. Not to panic you, but to protect you. Because once you understand this, you'll never look at your medicines the same way again. Now listen carefully, because the first one on this list is something people take without even thinking twice. Cold medicine. Yes, something as simple as trying to breathe better could actually be putting pressure on your heart. You wake up one morning, your nose is blocked. You can't breathe properly. You reach for that familiar pill or syrup, and within minutes, you feel relief. But here's what most people don't know. These medicines don't just open your nose, they tighten your blood vessels throughout your entire body. That includes the arteries feeding your heart. Now imagine this. Your blood vessels suddenly become narrower. Your heart has to push harder, faster, stronger, just to keep blood flowing. And if there's even a small blockage already sitting quietly in your arteries, that extra pressure can trigger something dangerous. This is important because many seniors already have some level of hidden plaque in their arteries without knowing it. And this combination, tight vessels, faster heart rate, higher pressure, can create the perfect storm. One man came in thinking it was just a bad cold. He had taken a common decongestant the night before. No history of major heart problems, no warning signs. But by morning, he was in the emergency room with severe chest pain. Listen, I'm not saying every cold medicine will harm you, but you need to be aware. You need to be cautious. And you need to stop treating these medicines like they are completely harmless. So what should you do instead? Start simple. Steam inhalation, saline nasal rinse, a humidifier in your room. These may feel basic, but they don't put pressure on your heart. And sometimes, the safest solution is not the fastest one. Now here's where things get even more serious, because many people don't just take one medication, they stack them, without realizing what's happening inside their body. Let me ask you, do you take something for pain? Maybe for your knees, your back, your joints? Something like a quick pain reliever to get through the day? Seems normal, right? But listen carefully. Because this next one is one of the biggest hidden risks for heart problems after 60. Painkillers. The ones you take without a prescription, the ones sitting in almost every home. Now I want you to imagine this. Inside your body, there's a natural protection system that keeps your blood flowing smoothly. It prevents clots. It keeps your vessels relaxed. It protects your heart every second. But certain painkillers quietly interfere with this system. They reduce that protection, slowly, silently. And what happens next is something most people never connect. Your blood pressure starts rising. Your blood becomes slightly thicker. Your heart has to work harder, and your kidneys start holding on to extra fluid. Now everything is under pressure, and this is where danger builds. Not in one day, but over weeks, months, repeated use. One woman used to take a painkiller almost daily for her joint pain. She thought it was helping her stay active, and in some ways, it was, but she had no idea what it was doing behind the scenes. Until one day, she started feeling tightness in her chest. Not severe, not sharp, just discomfort. She ignored it, like most people do, because it didn't feel like an emergency. But her body was already under stress. Listen carefully. This is how it happens, not suddenly, but quietly, building over time. And the most dangerous part? You feel normal until you don't. So, what's the smarter move? This is important. Don't rely on daily painkillers as your long-term solution. Start with alternatives, light movement, stretching, warm compress, even adjusting how you sit or sleep. Small changes can reduce your need for these medicines. And if you do need them, talk to your doctor. Ask, is this the safest option for my heart? That one question can protect you more than you realize. Now stay with me, because the next medication is something people take thinking it protects them. But the truth is, it may be doing the opposite, and almost nobody talks about it. Now listen carefully, because what I'm about to tell you next might completely change the way you look at one of the most commonly used medicines after 60. This is important, because this is not a painkiller, not a cold medicine. This is something people take every single day, thinking it's protecting them. Stomach acid medicines. Yes, the ones used for acidity, heartburn, or indigestion. Let me ask you something. Do you take a pill in the morning or before meals? To protect your stomach. Have you been taking it for months, maybe even years? If yes, then listen very carefully, because this might be affecting your heart without you even realizing it. Now, here's the hidden truth most people never hear. These medicines don't just act in your stomach, they quietly affect your blood vessels. Inside your body, your arteries need something called nitric oxide. Think of it as a natural relaxer. It keeps your blood vessels flexible, smooth, open, healthy. But certain long-term stomach acid medicines reduce the production of this protective molecule. And when that happens, your blood vessels slowly become stiff, inflamed, less flexible. Now imagine this. Blood trying to flow through tight, stiff pipes. Your heart has to push harder. Pressure builds, and over time, this increases the risk of blockages. This is not immediate, it's slow, silent, which makes it even more dangerous. One man had been taking this medicine daily for years. No questions, no breaks, just a habit. He thought, it's safe. My doctor gave it to me. But over time, he started feeling something strange, mild fatigue, slight chest heaviness, nothing alarming, just different. And like most people, he ignored it because it didn't feel serious. But inside, his blood vessels were changing. This is where people get caught because they think, if it's prescribed, it must be safe forever. But listen carefully. Some medicines are meant for short-term use, not lifelong habit. And that's where the risk begins. I'm not saying stop it. Never do that on your own. But you need to ask, do I still need this? Can I reduce it? Is there a safer way? Sometimes, simple changes help more than pills. Eating lighter dinners, avoiding late-night meals, reducing spicy or acidic foods, sleeping with your head slightly elevated. Small steps, big difference. Now stay with me, because the next one is something completely different. And honestly, it's becoming more and more common, especially in people trying to feel younger or more energetic. And this is where things get serious, very fast. Listen carefully, because this one directly pushes your heart into overdrive. Stimulant-type medications. Now you might be thinking, I don't take anything like that. But wait, these are not always obvious. Some are prescribed for focus, some for weight loss, some even hidden inside energy supplements. Let me ask you, do you ever feel sudden bursts of energy, followed by crashes? Do you feel your heart beating faster than usual, even without effort? Do you sometimes feel restless, jittery, unable to relax? Don't ignore this, because this is how your body tells you something is off. These substances increase adrenaline in your body. That's your stress hormone, the one that prepares you for danger. But when it's constantly elevated, your heart is under pressure. Your blood vessels tighten, your blood pressure rises, and your heart rate increases. Now imagine this happening daily. Your heart never truly relaxes, never truly rests. And over time, this constant stimulation can lead to serious problems. One woman started taking a supplement for energy. She felt great at first, more active, more alert. She thought, "This is exactly what I needed." But slowly, she started feeling her heart racing at night. Sleep became difficult. She felt anxious, without reason, and then one day, she experienced severe chest discomfort. Listen, this is how dangerous it can be, because these products don't always look like medicine. They look harmless, natural, safe, but your heart doesn't see labels. It only feels the effect. So what should you do? This is important. Be extremely cautious with anything that promises energy or focus. Always check what's inside, and if you're unsure, don't take it. Simple as that. Your heart is not a testing ground. Now pause for a moment, because the next one is something many people actually feel relief from, something that works fast, almost like magic, but comes with a hidden cost that most people never think about. And once you understand this, you'll start looking at it very differently. Now listen carefully, because what I'm about to tell you next is something many people actually feel grateful for. Something that brings fast relief, something that feels like a miracle, but behind that relief, there's a hidden pressure building inside your body. Steroid medications. Yes, the injections, the tablets, the quick fixes for pain, inflammation, breathing issues, skin problems. Let me ask you something. Have you ever taken a steroid shot for back pain or a course of tablets for inflammation? Did it make you feel better almost instantly? That's exactly why people trust it. Because it works. Fast, powerful, almost too good. But listen carefully. This is where the danger begins. Steroids don't just reduce pain. They change how your body handles fluid, sugar, and blood pressure. And all of this directly affects your heart. This is important, because when you take steroids, your body starts holding on to sodium. That means more water stays in your system, your blood volume increases, and your heart has to pump harder to handle that extra load. At the same time, your blood sugar rises, your cholesterol balance shifts, and your blood can become thicker. Now imagine all of this happening together. Higher pressure, thicker blood, more strain on the heart. This is not just one problem. It's multiple stress points hitting your heart at once. One man received a steroid injection for shoulder pain. The relief was instant. He felt like himself again. No pain. Full movement. He thought, "This is perfect." But within days, he started feeling unusual heaviness in his chest. Not sharp pain, not alarming, just something wasn't right. And like most people, he waited, hoping it would pass. But inside, his heart was under pressure. Listen carefully. This is how silent risk builds. Because relief hides the danger. You feel better, so you don't question it. But your body is dealing with something deeper. Now, I'm not saying steroids are bad. They are powerful and sometimes necessary. But the key is awareness and control, especially after 60. Never treat them as casual solutions. Never repeat them without understanding the impact. And always ask your doctor, is this the lowest dose? Is there an alternative? Do I really need this again? Because small decisions, repeated over time, create big outcomes. Now take a breath, because what I'm about to share next is the most controversial one on this list, and also the most misunderstood. It's something people take not because they are sick, but because they want to feel stronger, younger, more alive. And this is where things can go very wrong. Hormone therapies, especially testosterone-related treatments. Now you might think, this doesn't apply to me, but listen carefully, because this is becoming more common than ever, even among people who don't actually need it. Let me ask you something. Have you noticed lower energy lately? Less strength? Reduced motivation? Maybe changes in mood? Or confidence? These are real concerns, and many people are now being told, this is low hormone, you need treatment. And just like that, they start. Without fully understanding the risk, here's what happens inside your body. Testosterone can increase red blood cell production. Sounds good, right? More oxygen, more energy. But there's a catch. Too many red blood cells make your blood thicker. Now imagine thick blood moving through already narrow arteries. Slower flow, higher chance of clotting, more pressure on the heart. This is where the real danger lies. One man wanted to feel young again. He started hormone therapy. Within weeks, he felt stronger, more energetic. He thought, this changed my life. But something else was changing too, silently. His blood was getting thicker, his arteries were under stress, and one morning, everything changed. Listen, I'm not saying all hormone therapy is dangerous. There are cases where it is needed, but it must be carefully tested, monitored, controlled, not casually taken, not based on feeling alone. This is important because your heart doesn't care about how young you feel. It responds to pressure, to thickness of blood, to stress inside your arteries. And if those factors go wrong, the consequences are serious. Now let me bring this all together for you, because this is where most people make the biggest mistake. They treat each medicine separately. They think, this is for pain, this is for cold, this is for stomach, this is for energy, but your body doesn't separate them. Your heart feels everything together, every pill, every dose, every effect, stacking, building, increasing pressure slowly until one day it becomes too much. So what should you do starting today? Don't panic, don't stop anything suddenly, but become aware. Start asking questions. Look at your medications as a whole, not individually. Talk to your doctor. Review everything you're taking, and ask one simple question. Is this combination safe for my heart? That one question can save your life. Because prevention doesn't start in the emergency room. It starts at home, with awareness, and with the choices you make every single day.